Hey y'all, Shelly here with another tip for hospice nurses. So I'm continuing on with my series about how to document normal findings in a way that still supports eligibility for hospice patients. So today I'm talking about mobility and specifically ambulation. So let's say you have a patient that is ambulatory. We don't ever want to just document patient ambulatory. We want to first start with the negative word, because remember, we always want to do first word negative. So use a descriptor that describes what the ambulation looks like, because most of our patients are not just going to be jumping up from the chair and walking around. Most of them are going to be, slowly ambulating. Patient slowly ambulates the 3 or 4 steps to the bathroom, or patient slowly ambulates with an unsteady gait, shuffling steps, unable to lift feet from the floor, requires frequent stopping after 2 to 3 steps to hold on to furniture, to the wall, to inanimate objects, to other people, to whatever for support and to rest during ambulation. And how long does it take the patient to ambulate? What you also want to document, instead of what the patient can do, you want to document what they cannot do. So, so they could ambulate, but maybe they can't go upstairs. So patient is unable to go upstairs any longer. We had to move patient's bedroom downstairs due to inability to ambulate upstairs. Patient is unable to leave home because they're unable to go down the 3 steps on their patio, or whatever that looks like, what they can't do. Patient unable to stand from a seated position without assistance of at least one other person. So what they can't do versus what they can do. So when you're doing the ambulation, you're going to start with a negative descriptor of what their ambulation looks like, and then you're going to focus on what they can't do versus what they can do. Now, let's say that you do have a patient, and this is kind of rare, but there are going to be times that you will have a patient that is just completely ambulatory. They jump up out of their chair, they walk around, they walk faster than you do, their gait is steady. You don't need to restate this in your nurse's note. You're already going to address it in your flow sheet documentation when you get into your system assessment. So document it there, but just don't restate it in your nurse's note. It's not necessary to re-highlight that. So I hope this tip was helpful. If you have any tips that you think would be helpful for hospice nurses, please let me know. I'd love to share them here. And if there's anything you would like for me to talk about also, please let me know, and I'll do my best to address that for you. And remember, if we work together, we can change our world.